destroyed, arson attacks on 5G networks because they're allegedly spreading COVID-19. And of course, misinformation, disinformation, blatant lies, once again, that refugees and migrants are bringing COVID-19 to Europe. The list is long, the list is dangerous. And as we start hunting for a vaccine against COVID-19, a pledging conference is being organized by the European Union and G20 countries on that. Even as we speak now, we know that the vaccine wars, the anti-vaxxers, misleading information, fake news will grow and grow. So we need to be aware and we need to know how to fight it, combat it, overcome it, how to tell facts, not fiction. So today's conversation with 6 eminent panelists is about 3 things. Yesterday was World Press Freedom Day. And we know that journalists are in the front line. They can either combat fake news or they can fight it. Around the world, journalists are under fire in COVID-19 times, even more than before. Restrictions and curbs on their activities. But also some outlets are actually deliberately spreading fake news. And US professors of journalism have written to several media outlets, I won't name them, in the United States saying, stop this, you are destroying people's health. The second thing we want to focus on today is actually what is happening. Why are these lies spreading so quickly? It's true that in uncertain times like we're living in today, conspiracy theories do abound. But we've learned that this is being done by pranksters, scammers trying to make quick buck, being done by celebrities, and of course, unfortunately, also by politicians. And we're also going to see what is being done to fight this, to combat this, to overcome this, what codes of practice, what codes of conduct are being organized, drafted by the European Union authorities and others. And what is social media? What is social media doing to stop this? So these are some of the key questions we'll be talking about today. And we only have 60 minutes to do so, so we'll have to be short and to the point and precise. So the rules of the game are, please, when you ask your questions, when you make your comments, be as short and snappy as you can. So we'll get a real conversation going. Now, let me introduce the 6 eminent panelists who will bring their experience and expertise, their insights into this discussion. I'm going to introduce you to them very, very briefly. First of all, we have Hannah Storm. She's a CEO of Ethical Journalism Network, full disclosure. I played a part years ago in setting up the Ethical Journalism Initiative, as it was then known. We have Inma Vazquez. She's from Médecins Sans Frontières, very active here in Brussels and in the United Nations. She's MSF's envoy to the EU, very involved in work to do with refugees and asylum seekers, as you can imagine. We're really delighted also to have Ute Schaeffer from GIZ, the German Development Agency, a very close friend and collaborator of Friends of Europe. Daniel Braun is joining us from the cabinet of Vice President Věra Jourová, and he's going to talk to us also about what the European Union authorities are doing about this issue, about the scourge of fake news. Marisa Jimenez-Martin, she's Director and Deputy Head of EU Affairs at Facebook. Social media very much in the spotlight these days. Marisa, thank you for joining us. And last but not least, Juliane von Reppert-Bismarck, founder and CEO of Lie Detectors and a member of the high-level group on fighting fake news that was set up some time ago by the European Commission. So let's kick off this discussion. First of all, there is a question from Debating Europe, which is part of Friends of Europe. It's our online chat platform. And that question, I think, goes to you, Daniel. Rahul, my colleague Rahul Chola, will read it out for you. Rahul.
So this question is coming from Corinne. And the question is, in February, the WHO Director General said, fake news spreads faster and more easily than this virus, and is just as dangerous. Is this true? And if so, why is fake news so dangerous?
Daniel.
First of all, thank you for having me, and thank you for the question. Lies have always been here, but I think this current infodemic, as WHO calls it, illustrates how complex and multifaceted the challenge of disinformation truly is. I mean, you have the rapid spread of conspiracy theories, you have hoaxes, disinformation, misinformation, and this has been well documented, and there is also evidence that this affects health-related behavior, which can undermine public health and safety. It should be noted also that this accentuates other harms, such as consumer fraud or cybercrime. And as Shada said in the beginning, I mean, these fears around the pandemic are also exploited by foreign state and state-backed actors. And generally, crisis situations provide, uniquely fertile ground for proliferation of dis and misinformation. And the present crisis is no exception. What makes this crisis worse is the unprecedented global uncertainty that makes people desperate for information. And this higher demand inevitably, creates opportunities for bad information to flourish. Even more than under normal circumstances, and combine this uncertainty as a breeding ground for conspiracies with incentive structure of the digital world that favors cheap, low quality information rather than high quality content, and you have a nice event like this and something to be concerned about. But Europe has been built on crises. One danger is certainly health, but the second is a more general one about democracies, how we defend it against those who want to hurt it, but also how thoughtful we are in the response so that we don't overdo it and hurt democracies ourselves.
Thank you. Thank you very much, Daniel. Indeed, misinformation is dangerous and deadly and coming from all kinds of places. As I said earlier, journalists, of course, have to be extra careful not to mix fact and fiction. And regretfully, many are doing so. So, Hannah, I'm going to go to you first about what the Ethical Journalism Network is doing. What guidelines have you set for your members in terms of dealing with this unprecedented COVID-19 emergency?
Thanks, Shada, and thank you very much for inviting me to be part of this panel discussion. Just 2 points, I think, to underline this aspect that you mentioned of World Press Freedom Day yesterday. These are difficult and troubling times, uncertain times for journalists, and it's really important that we acknowledge that some governments are using COVID-19 as a way of clamping down further on press freedoms. And Daniel's point also about this uncertainty becomes this breeding ground and a desperation for news and for information. So I'm just going to share my screen with you now and just briefly whiz through some information that we have put together at the Ethical Journalism Network. I won't go through all of it. I will make it available afterwards. This is also online, and it's also at our Twitter handle at EJ Network. So we've pulled together these 7 points for covering a pandemic. And crucially, this is about ethical journalism. So this is about sticking to the facts. This is about practicing accountability. So accountability to our audiences and also holding governments and people in power to account. This is also about checking our use of terminology. We've seen lots of different scientific terminology floating around, and it's really important that we use the right, correct medical and scientific terminology as well. And also that we avoid certain kind of language and labeling that is inaccurate and that also increases discrimination potential, or it also increases the kind of difficulty that people are in. So for instance, in the United Kingdom, we saw a backlash when we heard that COVID-19 was the great leveler, in inverted commas. It's not the great leveler. Yes, it is something impacting us all, but we are all having different responses to it. The other important aspect is showing humanity. So this is a story that is about people, and this is about people who are passing away, who are dying from COVID-19. It's also about people who are surviving as well, and we need to know the humanity behind it as well as the numbers. I think we'll touch on this coming up shortly, but one of the areas of work that we do a lot of work in at the Ethical Journalism Network is challenging hatred. And it's really important because we've seen so much of this in disinformation that that we challenge ethnic or religious finger pointing, and we avoid racial and national profiling and labeling of the disease as well, and also stereotyping that further increases the situation of risk for vulnerable people. I'll move on rapidly to avoiding social stigmatization and stereotyping too. It's our responsibility as journalists to understand how essential our work is, and that we present this disease objectively and avoiding emotive language as well. And where we can, encouraging people to use available medical services, and also avoiding casting blame. And finally, this has been really important to me, and I'm very strong advocate of supporting journalists' mental health. We know this is an essential role that journalists are playing, but we also need to recognize that this, as we've heard already, are uncertain times, and this can impact on our ability to be resilient. And that's quite difficult. That can be difficult. So managers and journalists themselves need to understand that this is uncertain and that we're in this for the long haul. We need to practice a duty of care to ourselves, to the people we work with, to our audiences, and to the wider society. And I think all of those 7 factors, which I've whizzed through there, I appreciate, are really key in understanding the essential nature of ethical, good, factual, accurate journalism to help counter disinformation, misinformation, and malinformation at times like this.
Thank you. Thank you very much indeed, Hannah. Absolutely. These are very, very good. This is good advice to journalists. And I think the question is how many actually can follow it in times of stress, including political stress. But thank you very much indeed, Hannah. And you've given us the website. I'm sure many will be very, very interested in going and actually seeing it. Inma, one of the things that Hannah has talked about is combating hate speech. And we've seen that during this COVID-19 pandemic, there's also been a rise in racism. Populist politicians across the world, actually, but here in Europe as well, have unfortunately started talking even more against migrants and refugees as bringing COVID-19 to Europe. I was just wondering, what are you doing? How are you countering that kind of misinformation that leads to an increase in hate crimes?
Yeah. Well, thank you very much, and thank you very much for inviting us to this debate. So maybe I will start just nuancing what you were saying at the beginning, because you were referring to the populist media or populist politicians. But as you know, one of the aspects in which we insist a lot in MSF is that in these narratives is also the mainstream and the institutional narrative that are contributing to misinformation, yes, and yeah, sometimes to racism or other discrimination, or justifying also more discrimination towards vulnerable groups, and the fears, as I was saying, of the people in the disease, which, by the way, it happens the other way around, because now in the humanitarian context in which we are working, we are accused of bringing the disease as well. So this is happening in every direction now. Okay? But in terms of the vulnerable groups and migrants and refugees in particular, in MSF we are concerned about all the narrative about border closures, about quarantines, about securing supplies and securing essential medicines, and the way this has been presented to the public by, again, the media and the institutional narrative has created confusion and has been used to justify things that are not justifiable as in terms of public health. So the border closure, there is part of it that is public health, but this doesn't avoid that the people can enter in the adequate manner to Europe. And indeed, the guidelines, the European Commission guidelines on the border restrictions include the exception of those that seek protection, and also the exception in humanitarian terms. This is not being applied and not being explained. In terms of the quarantines, yes, the quarantine is a public health measure, but the quarantine has to be proportionate and has to be non-discriminatory and cannot put the people at additional risk. And some of the measures that were being taken in the camps at the very beginning of in the camps in Greece, but also in Italy, and just in the narrative, it was to say, oh yes, the camps have to be closed. The services cannot come to the camps because they are going to be at risk. The ones that provide the services, not the people in the camps. So I mean, some has been corrected, but it's still something that needs to be worked out. And then on all this issue of securing, and we hope the Beijing conference and is going to involve a change in the narrative, but is that we need to secure our medicines, we need to secure our supply without explaining how the criteria to distribute the existing supplies have to be put in place according to the principles that are explained by WHO and that are internationally recognized. And also creating misinformation, like for example with the chloroquine, with some of the antiretroviral drugs that are being used, like everyone is like interpreting this is the solution, we need to keep this, and all this generates complicated dynamics that put people at additional risk.
Thank you very much, Inma. So really a rather gloomy, grim look at what already existent racism and anti-discrimination and all that is all getting mixed up, and the rhetoric is being ratcheted up. So really something to be aware of and to make sure that we don't mix, again, as I was saying, fact and fiction on this. So thank you very much, Inma, always, for bringing in your perspective. It is valuable. And what you said about mainstream narratives also turning and embracing some of the far-right rhetoric, that's something that we at Friends of Europe have been warning about for very, very long. Thank you. We'll come back to you with some other follow-up questions. Uta, I wanted to turn to you now, GIZ. You also used to work at Deutsche Welle Academy until a year ago. And you have said to me in the past that, yes, misinformation, disinformation is very bad here in Europe. Gullible people are following false advice, bogus medical advice, but that this is even more destructive in emerging economies where communication channels and where people are less aware, if you like, of the need for media literacy and to be more aware of fake news. Please, Uta, floor is yours.
Yeah, thank you very much. And thank you for inviting me. And yes, it is very clear that disinformation is more harmful in contexts or in countries with weaker communication infrastructure, with very strict autocratic governments, with a strong oppression of media and journalists. So in these very weak circumstances, disinformation could really have a very, very bad impact. I think we should acknowledge that we are dealing with a multi-layer problem, and it's not enough to just counteract or try to debunk disinformation that comes always too late. I think it is the question of creating a landscape of professional information, and we see in this corona crisis that worldwide the public is very information dedicated, very keen to get accurate information, and that we have concerning corona a lot of different sources, and many of them are originated in science. So we could assume that globally and theoretically we have a good access to a variety of sources, and that is part of the problem, because we have a lot of information, or too much information. On the other hand, we have this uncertainty of which my other colleagues already spoken. I think, and this is an approach with what GIZ is doing and developing with its partners worldwide, it needs an interdisciplinary approach, and it really needs approaches which are very dedicated to the local community's needs. And I come up with an Ebola example because I think we could always learn from information crisis management before. During the Ebola crisis, we saw, especially in Western Africa in 2014 and in the DR Congo in 2018, the tremendous negative impact of wrong information. That, for example, the international aid organizations were behind the outbreak. And that made in the beginning the spread of the infection very intensive, and information was key in how far the crisis, the Ebola crisis, could have been managed. And the right approach was to work directly with the communities, to speak their language, to use their media channels, to use their context and contents, and I think to make it very shaped to what the community wants to be addressed. And we have to take into acknowledge that there is not the simple, let's say the simple formula that social media is key. Social media is a very dominant factor in this system, but in Congo, for example, it is oral information which is powerful, and radio. So in Congo, for example, I think radio and oral information is key. And GIZ is trying to establish this community dedicated and local approaches. We are doing it together with our partners who are the best to deal with the situation on the ground. And to just put one example on the table, we come to very different solutions with them. In Cambodia, for example, Facebook is the most important platform to distribute false information. And there, for example, together with the WHO and with the Ministry for Health, we are establishing, let's say, a campaign of professional and objective information on Corona and the measures which have to be taken. And in Western Africa, for example, we are trying to establish or to implement an app to get better information about infections in the country. So I think there has to be an answer which is appropriate to what people expect, and there's not one solution which fits all. That is the bad news. But I think, and I hope we come back to in the discussion, we have to establish and develop answers which are very dedicated to the local conditions.
Thank you very much, Ute. Thank you also for bringing in what has been happening in Africa, in Asia as well. And your point is well taken that there's not just one-size-fits-all remedies to fight back against fake information, fake news, etc. Also, thank you for pointing out to the community approach, that it's not just the media, it's just not the leaders, but community leaders also, and perhaps also religious leaders have a role to play in this as well. So thank you very much indeed for bringing in that different multi-layered approach that has to be taken. So sharing best practice, obviously, is very important. Daniel Braun, from the cabinet of Vice President Věra Jourová, let me come back to you to ask you a bit, because Ute did talk about Facebook, and we know that social media platforms, not just Facebook, but Twitter and others as well, are playing a role in maybe unknowingly disseminating fake news, medical news. I'm not talking about geopolitics here, but really harmful cures and just sort of bogus remedies that are out there. But they are trying hard now also to curb that and overcome that. Tell us a little bit about what the EU authorities are doing. Do you have a code of practice that you're working on? And have you had a good response from social media platforms?
Thank you, Shada. I'll try to put this into a wider context also, because hate speech was mentioned. And in my previous mandate, I was working on the code of conduct to counter illegal hate speech, where we were in the field of criminal justice, and this was about removing illegal content. On disinformation, we have to be much more careful also, and from the public, authority side, with medical scales, I would say, to guide the response. First of all, disinformation and misinformation as such are not illegal. Second, the dangers arise from organized campaigns, but also from an overflow of information across the information space, including organic sharing among users. And these are two issues that are different and require different solutions. And third remark, before I get to our cooperation with the IT platforms, despite the platforms having gatekeeping responsibilities, I think it's important we don't lose focus on the sources of disinformation and misinformation and the audience, which brings, of course, a broader issue of media literacy and critical thinking. And it's good that we have this event the day after the World Free Press Day. Because that's the first line of defense, civil society, professional media, who have a crucial role in giving room to authoritative content and, you know, giving integrity to the information space. Now, on the cooperation with the IT companies, we have a lot to build on. We have the Code of Practice Against Disinformation from 2018, which was a self-regulatory, voluntary code allowing, you know, platforms to fight disinformation by scrutinizing advertisements, by deploying transparency measures, by deleting fake accounts, fighting, you know, malicious use of bots. If I focus now currently on health dimension and the online sphere, we are in constant contact with the main platforms, including Facebook and Twitter. And I have to say they have been very reactive. We have discussed, among other things, promoting authoritative sources like WHO and demoting fact-checked content to reduce their visibility and the potential to virally spread and hurt people. And they are also taking down content, obviously, that could kill, like drinking bleach advice. So I feel the response has been good. They are also quite creative in launching new services to channel users to authoritative content. But I leave the PR to Facebook, who will talk after me, I guess. Maybe last thing to mention is that there are things that, of course, should be improved and will continue working to have platforms, you know, improve fact-checking across all member states, to remove better the financial incentives for disinformation websites, or to provide more transparency on how they handle the content.
Yes, thank you, Daniel. So very important measures being taken now. We've been warned by the WHO and other medical experts that this is an unprecedented moment, of course, but there could be other pandemics, there could be a second wave. We're being told that this is not going to go away that easily. So we really have to be prepared for other crises, health crises, to come in the months ahead, the years ahead. So we have to really take precautionary measures. So Marisa, that's why I'm turning to you. Very much social media in the spotlight, being asked questions. Are you doing enough? Have you done enough fast enough? And I was wondering, what is Facebook doing? Are you actively seeking out hate material, false medical advice, and erasing it from your platforms? Are you directing your readers and others to the authoritative sources? What exactly are the steps you're taking, Marisa? Thank you.
Thank you so much, and thank you for the opportunity to be at this very interesting debate. I think that before going to the core of what we're doing on misinformation, just our approach and how we're responding to the COVID crisis in general, because everything is interrelated. So obviously we're supporting health and economic relief efforts, but we're also connecting audiences and users to information, to communities in a times of confinement where that conversation cannot happen in person. We're also supporting the access to authoritative sources of information, health-related and wealth-related, wellness-related information, and we are tackling and trying to limit the spread of misinformation on the platform as well. And when it comes to dealing with misinformation on the platform, access to accurate information is absolutely key, and I think it's been mentioned by some speakers before me as well. This is why a few months ago we created a coronavirus information center in collaboration with global partners, with the WHO, with the CDC, so international health institutions, so that users can go there easily and find relevant information to them, updated information about COVID-19, tips on safety, etc. Now, what is really important about access to information, and it was mentioned before, and I want to mention also in the context of Facebook, is that one size does not fit all, in that in order to make information relevant, we need to, it's not only about the information as well, but also about the users that are seeking that information. That means that we would not only looked at global institutions, very reputable institutions like the WHO or CDC, but we wanted to collaborate with European institutions, regional institutions, and also local authorities, because that makes the information also more relevant to people. Now, it's not only about information on Facebook and Instagram, but also how could we find effective ways to provide that information on COVID-19, on things like wellness, how to deal with the domestic violence, for instance, in times of crisis. How can we use our messaging services for that? And that's why we've, in partnership with some of the people I mentioned, we also have some services on WhatsApp and on Messenger. Now, coming really quickly to the core of dealing with misinformation on the platform, we do that on COVID-19. We do this in two ways. We remove information. We remove not information, but we remove misinformation on misclaims about cures, prevention, the misclaims about the availability of essential services, or even the severity of the outbreak. This is very important, it's a moving target. We remove on the basis of the guidance that we get from partners like the WHO. And as I say, things, circumstance change, and what we remove could also change as well. The bulk of misinformation on the platform, however, is about things like conspiracy theories that do not link to a immediate physical harm. So if they don't link to immediate physical harm, we will not remove, we will simply demote. And how do we do that? Well, we work with the fact-checking community, more than 60 fact-checkers around the world, who will look at the content, will rate it, we will then label it, and link to accurate sources of information. As you can imagine, we can talk about the volume is very high. In the month of March, we labeled 40 million pieces of misinformation on the platform, and on the basis of more than 4,000 articles from our fact-checking community. That is a lot, and that means that we also had to put more focus on expanding the capability of our fact-checkers, and also partnering even more with the IFCN. I'm going to leave it there. There's a lot more, but I'm sure that we can get back to the debate later on.
We will indeed. I'm going to turn to Juliane in a second. Juliane, I just want to say to all of you online from across the world, from Europe but beyond, also listening in online, please do send us your questions. You can do so on Twitter, #FOE debates, and please start preparing your questions, because after Juliane's response, I'm going to turn to you for your questions. It's your time then. So Juliane, question for you. First of all, your comments on what you've heard. We heard about the importance of fact checkers. You work with lie detectors, same thing. But also, how difficult is it? Because a lot of the misinformation is coming not from weirdos, crazy nutters, some of it from celebrities, some of it from politicians. Fringe conspiracy theories are making their way into mainstream newspapers sometimes. So how do you go about your task of fact-checking and detecting the lies, separating fact from fiction?
Thank you. That's a very good question. And thanks so much for the invitation, and particularly for placing such an accent on the issue of disinformation. You're right, it's a really difficult topic, and it's one that concerns us very much. We are a journalist-led non-for-profit organization, and we work to secure democracy by empowering young people to sort fact from fiction online. And you're right, it's very difficult to regulate this problem. One is the very obvious issue of censorship and placing limits on press freedom, like Hannah was saying. Another is that regulating, in any case, is a very lengthy process, which in a situation as urgent as this, and given the remarkable lobbying efforts that the platforms deploy in Brussels, and has been widely reported, may not in fact provide the sort of fast results that we need in a situation like this. So, nonetheless, we do see that, there are some areas worth exploring on the regulatory front. you know, to install some rules along the super highway along disinformation travels. Disinformation has existed forever, but right now it's being allowed to travel at breakneck speed. And that superhighway is the platform. So the questions that we would like to see addressed are questions of, you know, natural monopoly, or as Daniel said, removing financial incentives. What are the links between the advertising revenue business model of the platforms and the rampant dissemination of viral and emotive content, which is actually then immune to logic and reasoned debate that comes with fact-checking? And should there be limits on the gathering and monetization of hyper-personal and hyper-private data, such as human emotions like anger and like fear, which so much of disinformation relies upon? And finally, I want to say something about fact-checking before I get onto the point of which we get onto, which is the demands of platforms that they conduct fact-checking. It's no doubt a very important issue, but it's also very problematic, not only because it edges so close to censorship, but also because it would currently appear to be hard to reconcile with the current business model of the social media platforms. But also because of this, disinformation is increasingly sophisticated. It splices truth and fiction in a way that can confound, you know, even the most astute fact checkers, and it wrongly assumes that platforms have their eyes everywhere, which they don't, and that fact checkers have their eyes everywhere, which they do not. We mustn't forget that we keep referring to disinformation flows in terms of what we can see, and that is Twitter or Facebook or you know, other platforms that are visible. What we can't see is the sphere that Mark Zuckerberg has called the digital living room. And this is what we see that young people, the young people that we'd work with who are aged 10 to 15, work on. They are not on Twitter, they are not on Facebook, they are on Instagram, on WhatsApp, on YouTube, on Snapchat, on TikTok, you name it. They're even on Twitch. They get their information on gaming platforms. And this is very far from the eyes of content moderators and fact checkers. And therefore, in the meantime, what we work on is the building of resilience, the building of critical information literacy or media literacy, which is really key to ensuring that everyone should be able to navigate the online universe safely. Because what we're seeing right now is disinformation that is confusing people, that is undermining their trust in the kind of institutions that are designed to protect us, and which makes the informed decision-making process upon which the democratic process relies so very difficult. So we work with children and their teachers. We help them look at what is a fact, to distinguish between a fact and a fiction, to be able to click away, to really start valuing that kind of basic lateral and digital literacy alongside normal literacies that we think of, like reading and writing. We think that the OECD should integrate this into gauges that determine the school rankings, and it should also be within all teacher training curricula, so that teachers actually feel confident to address this themselves with the young people. And we've started doing this in a Corona format. We're also starting to do it with senior citizens now during the learning at home time, and the response has been really, really positive. So people do respond very well when you give them tools, and they seem to be really excited about being shown how to use them.
Thank you very much, Juliane. Thank you very much. I'm glad you mentioned senior citizens, because my experience is that, yes, our young people are getting more and more media literate, and of course, organizations like yours are helping, but senior citizens sometimes get forgotten, and a lot of fake news and misinformation circulates there as well. Thank you very much. Now, I just want to say that those of you who are on Zoom here, we can see you. Please, you are also very, very welcome to ask questions. So just put up your hand, do this, and I will see you and give you the floor. So as you do that, I'm going to turn once more to you, Daniel, because I think Juliane raised a point that was really important. She talked about digital living rooms and the importance of WhatsApp and TikTok and others that I really don't know because I'm not that young. But are we also addressing those issues rather than just the big social media platforms? Please.
Well, these living room apps are usually part of a larger company, so It's quite a concentrated world in this sense. But yes, we've had discussions with Facebook, for example, about measures that could be taken on WhatsApp as well. I think we also need to differentiate a bit the long-term solutions. I think in the COVID context, we cannot solve immediately all the, for example, the removal of financial incentives for advertising. I think that requires a slightly longer conversation also with the advertising industry and with political parties and those who advertise. But we aim for that by the end of this year to do a European Democracy Action Plan to address the broader issues. So we're really concentrating now, and you might see something very soon on COVID-related disinformation. Part of that could indeed be, and we'll have conversations about that with the IT platforms, measures to address platforms which are not moderated and where it's really about organic spread, but where it's also more difficult to moderate the content or to influence how it spreads virally. But there are certainly measures I see that are possible. I'm sure Marissa can develop them. I've seen good examples from Spotify, other companies that proactively channel users to WHO and other sources so that they don't have to, install a chatbot and other rather difficult issues, because much of the misinformation is really about miseducation and lack of access to good information.
Right. I'll turn to you, Marissa, because the point has been made by Daniel. Can you give us a little bit of an insight on the digital living room apps that, WhatsApp, etc., that what's being done on that front?
Sure, of course. So there might be a confusion whether the town hall and the living room, indeed, that it's a way to explain the different types of services that there are. And what I'm saying, that when people connect to each other, they do it differently, right? There's not one way in which you connect or you talk to people. It's not the same to be in a family, right, in your family room, than you are in your office or when you are with your friends. And that's a little bit of an analogy as to how different services serve different needs of users. But of course, the differentiation of services also comes with challenges in that you will not be able to apply the same measures in the same way in one type of service or on another. So an example of that is WhatsApp. WhatsApp is a service that is very different to Facebook, yet that doesn't mean that there shouldn't be any ways in which we should provide not only information to users to counteract the spread of misinformation, but also how do we limit the spread of misinformation on the platform, and how do we allow the fact-checking community to also do their work on WhatsApp under the circumstances of a service like that. So there's some things that we mentioned, some things that will be announced very soon, even today. So stay tuned to that. But in terms of WhatsApp, we have seen, for instance, users getting daily updates on information, daily updates from the WHO. So you have to actually ask or request that, and you will get that. And not only that, but international organizations like that are using it, but also local governments as well. So you see, and the list is growing, right? So you have the Croatian government, the Spanish government, the French government. They're all using the WhatsApp Business API to get to the users, to get to the citizens. So it's growing, right? More things will happen. Nothing is ever enough. And we always have to grow and make progress. I have to say that Juliane made a point about investing in critical thinking from all audiences, from children and beyond, in all types of audiences. That is absolutely critical, and I think it is part of our strategy as well. And again, we'll continue to invest in this area. The second thing that I wanted to say, and then I will just be quiet, is that because a lot of people talk about journalism, and its access to information is not only about the WHO or health authorities that will give you back information. It's about how can we help good reporting and coverage about COVID-19. How can we help journalism? And there's some dedicated efforts in that area as well that are very, very important, and we should not forget about them. And always never enough, and we'll continue to invest in those. Sorry.
Right. Thank you very much. I'm going to go back to all the panelists for their comments as well, but Rahul Chawla, my colleague speaking on behalf of Debating Europe, has a few questions. Rahul, would you like to give them to us, please?
Yeah, so we have one question from JTHK, who asks whether we can reasonably expect to counter the threat of misinformation and disinformation when the US president himself is so actively involved in creating and disseminating it. Then we have one from Pedro, who argues that the problem is social media, unlike traditional media, because it doesn't have an editor. This raises the question, should we think of social media giants such as Google and Facebook as publishers or as platforms? And I have one more.
Yes, go ahead.
Andrew, who thinks a way to counter this issue would be to have large search engines such as Google or Yahoo, etc., fact-check websites automatically with their algorithms and then place a little star next to search results that are certified as trustworthy.
Thank you very much, Rahul. In fact, the first question from JDHK on how do you actually combat misinformation if it comes from politicians, I think this is a very important question. And it's also linked, isn't it, to the fact that we are in democracies here in Europe. And how do you counter misinformation in democracies without being accused of self-censorship or even censorship? I think those questions are related. So let me go back to the panel, and if you want to comment on the other questions that Debating Europe has asked, please do so as well. Hannah, let me go back to you to get your comments, please.
Thank you.
Hannah.
And I think it's, thank you. I think it's really important, and I'd like to point you to our website. We have been publishing pieces by media experts every day for the past month about different aspects of misinformation and ethical coverage of COVID-19, particularly the instance last week with President Trump. It's really, really vital that as journalists we call that information out. Now we have to do so sensitively on specific areas like that because of there are specific guidelines for that kind of disinformation and misinformation. So if he is suggesting something is potentially incredibly dangerous, incredibly difficult for people's health, then we need to point people to the right kind of resources. The expert medical guidelines and resources, for instance, the Samaritans has put out really, really good, important information about suicide, for instance, and there were some suggestions in that regard that what he was doing was inflaming the situation and creating extra vulnerability for people at risk. So we need to hold the powerful to account. As I said, we need to go back to medical experts to show what is proven to be the case, even where we're not sure that science always has the answers, because we know that also to be the case. We need to make sure that we are reinforcing all of those elements and that we are doing so in a humane, sensitive way as well, recognizing that this pandemic, this COVID-19 crisis affects everybody, but the impact it has on people is disproportionate based on people's vulnerability as well. And I would say that if we're seeing this from the supposed leader of the free world, this is a massive, massive problem for us as journalists. And it really does go to underscore even more our need for solid, factual-based, ethical journalism.
Right. In his defense, he did say afterwards that he was being sarcastic. And also, let's be fair, misinformation of this kind is being spread by politicians, not just in the United States, also in the United Kingdom and others as well. So it's true. And celebrities also, if you go online, a lot of celebrities hawking, peddling some rather bogus and spurious medical advice. Thank you very much indeed. I'm going to turn to Inma in a minute, but I do see that we have representatives of Thailand, Bosnia, Costa Rica in our Zoom room. So if you have any comments or any best practice that you want to share with us, please just put up your hand and I will give you the floor. Please do so in the, as we go on in this discussion. We just have about 10 minutes left. So Inma, let me come to you and ask you about that. Democracy, misinformation, and shouldn't we be more careful, shouldn't politicians be more careful about not inflaming existing prejudices and stereotyping?
Yes, thank you. Indeed, I wanted to insist or to link to what was said by Hannah to remind that, I mean, when we talk about a response to a health issue and to an epidemic, in this case, in what politicians and again journalists or responsible media need to insist on is that the response is a people-centered approach. So it's to try to not to focus that much on the security approach, which is invading or using a lot of the space, but to come back to, so it was mentioned the humanity, it was mentioned that this is a health response is a people-centered approach that needs to be adapted in each of the contexts according to the needs of the different people, including the vulnerable groups or the people in contexts in which you need to adapt the response in a different way, as I think the GIC representative was saying at the beginning. So, and we have the experience also, it was mentioned before, on the Ebola response, and there are a lot of parallelisms to be made, but we should have the lessons learned already, and we are afraid that we are repeating the same messages, the same mistakes.
Do you see, Inma, do you see any change after, in the middle of this COVID-19 pandemic? Are you seeing people becoming slightly more, let's say, humane, or do you see an escalation of prejudices?
There are elements for both. You see in some of the reactions, you see more polarization and discrimination, but you also see signs of opportunities to bring solidarity on the table, and again humanity and people. So it is a mix of the two, and we need to do our best to bring this positive part to the discussions, and so that also people appropriate themselves of this rhetoric instead of the other narratives that are dangerous and that are not helping in the end anyone. So because it does not help in the response.
Right. One of the questions that I received prior to this conversation, actually, I think, Uta, you would be best to answer, is about how we in Europe may not have learned fast enough from what Africa had done with the Ebola crisis, what Vietnam, South Korea, Singapore, you mentioned Cambodia as well. Are these best practices, the right medical advice, quarantines, masks being available, contact tracing, are these best practices, medical best practices? Is there enough international transparency and exchange of information from your experience? Uta, yes.
Our conversation and debate, it comes into my mind that a good crisis management is always depending on the right sharing of responsibilities and duties. So if we are not clear in our roles, given the fact that political influencers or leaders are, for example, distributing the information of this the disinfection things, or putting light into bodies to combat corona, then I think we have there a neglectance of having a certain responsibility and role. And there are a lot of governments who are abusing the situation to really oppress media and journalists. And I just mentioned three. It is Iraq, where the Reuters news agency isn't able to work anymore because they don't have the license. It is, for example, Egypt, where the Guardian reporters were forced to leave the country. And it's also China who's now designing a rosy propaganda picture of how well the crisis was managed. And I think if in the context of a crisis management, roles are abused to oppress or to weaken the stakeholders of the media and information system, then the development is worse than in a situation where everyone is very well aware and able to fulfill his role. And a second point, and it was so well established, I think, in our discussion, is that there are several steps to be done in dealing with disinformation and misinformation. First, we need the technical infrastructure. I do it from the user's journey, from the perspective of the user's journey, perhaps. We need to have an access to information by technical platforms, by broadband access, and so on. We also need to have good content. For example, I have to read in English to use a majority of sources in the Corona pandemic. And if I don't have the access to have a good content which is speaking my language and it's using my platforms, for example, WhatsApp in Nigeria or Facebook in Cambodia, perhaps I will have no access to the information. And we need a government context which is not oppressing media and journalists, as we described. And coming back to what Juliane said, and I was engaged for several years in this field, I think media literacy is key, because this fact-checking, there is one role which is clearly dedicated to the platforms and was explained here, but there's another very individual capacity. And this is exactly the answer to your question, Shara, because I think, especially in Europe, we underestimate media literacy issues. Perhaps it's not Corona, perhaps here in Europe we could see also some political disinformation campaigns eroding our democracies. And I think we are really underestimating the media literacy issue, and we should put it into our educational system simply. And yeah, thank you so much. I stop there. It's too much.
No, thank you very much. Let me just get a last comment from Juliane. Very quickly, Juliane, we just have 3 minutes left, and I'd like 2 minutes left for you, 1 minute for me. Juliane, very quickly, some responses to what you've heard.
Thank you very much. I actually wanted to go back to the question of one of the members of the audience about liability and considering who is a publisher and who's not. There is actually a very interesting debate going on in the United States at the moment about whether to revoke Section 230 of the 1996 Communications Decency Act. And that is an act that in 1996 granted great limits to liability to those who carry information online. And there is some talk about changing that. But again, that's going to be incredibly difficult to do. And let's also not forget that even publishers of traditional media are currently under great pressure to match the clickbait that the blogs and the various platforms are putting out there, the various users of various platforms are putting out there. And so even among traditional publishing, there is a real erosion in the ability to generate the revenues that presuppose quality and ethical journalism. So again, once again, for us, everything leads back to media literacy. If we're going to be navigating this online universe by ourselves and unmoderated, which so many of us do, and if we are going to be piecing together our worldview independently, no longer in the traditional format of learning facts from somebody who knows best, then we're really going to have to need the skills and the tools to do that. And in fact, the Corona crisis is an amazing moment to do this because everybody knows the value of facts. A few months ago, we always talked about that facts and the value of facts needs to actually be emphasized, especially to young people. But right now, this is a moment when people do want facts. And if we can transmit to them the tools of doing so without verging immediately into the political, then, and actually just giving them the tools for them to do it, they're not that difficult sometimes. Sometimes it can be quite easy to unmask a fake. And when people know those tools and have that critical muscle instilled, then a lot of good things can happen and a lot of resilience can really start taking hold in society.
Thank you. Thank you very much, Juliane. I see that the ambassador of Costa Rica would like to intervene very, very quickly. Can I... The ambassador of Costa Rica would like to come in.
Hello. You hear me? Yes. Okay.
Yes, please, sir.
There is a question on the anonymity of the users of the different platforms. I know that there is a big discussion on this, but the question is if the EU have thought in regulating this matter or in establishing the need of identification of the users. And also, can this be a solution from the legal standpoint of view? Could be very useful to appoint responsibilities, but I don't know what the platforms have talked about this or the community.
Thank you. Thank you very much, Ambassador. Let me go quickly to the two people here who have been talking about the media platforms. That's Daniel and Marisa. If I could have a very quick responses from you, please. Thank you.
Well, I'm just here. I'm not the commission, so I think that the question was addressed at the legislator, the policymaker, not at the platform itself.
It was.
But if I may, on the Facebook front, I think that there are different policies. We cannot. Not every platform has the same has the same requirements. We do have a real name policy on Facebook. That is not the case on other platforms. For us, it's not so much about the identification of the user, but about whether the rules of the game, whether the terms of services, the content standards or the law are being abided by or not. So that is more important than determining who that or verifying the identity of a person on the platform.
Thank you. Thank you. Is Daniel Braun, are you still with us here?
I am. Hello.
Oh, great. I couldn't catch. Technology is marvelous when it works. Please, a quick response from you. Yeah.
Not an easy question for a quick response. I think on anonymity, we have to be quite careful because also internet can be and social media can be one of the very few ways in certain countries to express opinions on verification of users. I think that's a case that we should look at. There will be a Digital Services Act, the sort of revised e-commerce directive, which defines the responsibilities of online platforms. And I think this could be one of the questions that will be assessed. There will be a public consultation launched quite soon, and I would imagine that one of the issues that could be, discussed is how to also better protect users and without removing the anonymity, which I think would be difficult to do.
Okay, thank you very much. Thank you very much to all 6 panelists, to Hannah Storm, Inma, to Uta, Daniel, to yourself, Marisa, and Juliane. We've looked at this issue of the health COVID misinformation pandemic, which we're all aware of from very different points of view, but it's part of a full picture of how you can deal with it. Accurate reporting, better journalism, ethical journalism, Hannah, with the 7 guidelines that you've announced for us, and they're on your webpage. We've looked at the issue of refugees and how that narrative of stereotyping, discrimination, toxic narrative can be countered as well, including by institutions that we are aware of, and politicians, of course, as well. We've talked about best practice. Ute has told us about what's happening in the rest of the world and how we need to be solidarity needs to be there when we talk about how to counter these narratives, false narratives. We've also talked to Daniel and to Marisa about platforms and codes of practice, so important in these days. And Juliane has, of course, talked to us about critical thinking, critical learning. So we've looked at it from all points of view. I would thank you, I'd like to really thank you for doing that, because as I said initially, as we move forward, there will be other crises of this kind. Even COVID-19 may come back. We need to be, I think this time around, better prepared to provide our citizens, you, me, our parents, our children, with better information, authoritative sources. We need to bolster the authority of those authoritative sources. So we need to really be aware that this is something that concerns us all. As I said, today or tomorrow, we'll have this pledging conference on finding new vaccines. Everybody will be working together. But I fear that once again, there will be vaccine wars and propaganda about vaccines. And of course, the anti-vaxxers amongst us have not yet spoken. So thank you very much indeed to our panelists. Thank you to all of you for joining us at Friends of Europe. Tomorrow at Friends of Europe, in the evening at 5 o'clock, we'll be having a conversation with Vice President Schaeffer of the European Commission. We'll be talking about at 6 o'clock, sorry, at 6 o'clock, we'll be having a conversation with Vice President Schaeffer on demography, democracy, and Europe's destiny. Thank you very much indeed. Stay safe, stay healthy. Thank you.